Hi, I'm Keith Murray with Integrity Senior Solutions. I want to welcome you to this 5-part series on the basics of Medicare. Our intention is to help you to wade through all the information that you're getting. I know that if you're turning 65, going on Medicare for the first time, you're being bombarded with mail and phone calls and people trying to get in touch with you to tell you about their plans and whatnot. First of all, I want to make sure that you understand how Medicare works. We're going to break it down to you, each of the parts, so that you can better understand how everything fits together. And in this specific video, this first video, we're going to talk about the parts and the plans of Medicare, and we'll get right to that. A couple of terms that you hear a lot of when referring to Medicare are parts and plans of Medicare. You have Medicare parts and Medicare plans. The parts refer to the different segments of the Medicare program itself, the government program known as Medicare. You have Part A, Part B, Part C, and Part D. Under the plans portion, that is going to be referring to the supplemental plans or Medigap plans that you buy in addition to your Medicare, such as a Medicare Supplement Plan F or a Plan G, a Plan N. These are some of the plans you may have heard of. This is the Medicare and You book that is put out every year by the Centers for Medicare and Medicaid Services. And as you can see, this is the official U.S. government Medicare handbook, as it says right on the front there. Every year, CMS puts this book out to cover how Medicare works, what you need to do when looking for coverage to go along with your Medicare. It covers all the deductibles for the new plan year. And we're going to dive right into all of that. So let me jump right here to page 15. And this shows you the different parts of Medicare. As I mentioned a moment ago, this refers to the different segments of Medicare and how it all works together. You have Part A, which is your hospital insurance. That's going to cover inpatient care in a hospital. It's going to cover skilled nursing facility care, hospice care, and home health care. Now, Part A, you pay for that all of your life when you've worked. As long as you've worked at least 10 years or 40 quarters, then your Part A is going to be free for you. You won't have to pay any premium for the Part A of Medicare. Now, Part B covers the medical insurance, which is doctors and physicians, any outpatient care, home health care. There's some covered under Part A, some covered under Part B. Part B is also going to cover some preventative services and durable medical equipment, as you can see here. Now, Part B does have a premium to it, and we're in 2016 when this video was recorded, and this year the premium is $121.80 for most people. Now, if you have a high income, then that amount may be a little bit more, but for the vast majority of people, it's $121.80 this year. So that's Medicare Part A and Part B, and that's going to cover all of your medical, hospital, outpatient, doctors, all of that is covered under Part A and Part B. Then you also have Medicare Part C, which is going to refer to the Medicare Advantage program. Now, I'm going to do an entire video on Medicare Advantage versus Medicare Supplement and show you how both of those plans work. But basically, Medicare Part C is a replacement of Medicare. You actually go completely onto an insurance program, which is usually an HMO or a PPO, and you are not, when you go to a doctor, you don't even give them your Medicare card. You only give them your insurance card. So it's an alternative to Medicare that you go on under Part C. Medicare Part D is the prescription drug plan. And so those are the 4 parts of Medicare. And we're going to get into a little bit more of the co-payments and how Medicare Part A and Part B specifically work. So I've pulled up here on your screen an outline of coverage. Sorry, I pulled up an outline of coverage from one of our companies that shows you all the deductibles and the copays for Medicare. Now this is for 2016, and these amounts change every year. But I want you to understand how the deductibles work. In 2016, if you are to go into a hospital under Part A, as you can see up here, this is Medicare Part A. When you first go into a hospital, you have a copayment of $1,288. Now that $1,288 is going to cover you for 60 days. So if you go into the hospital for 3 days and let's say you get better and come out, and then 2 weeks later you have to go in again, you don't pay that deductible again because you're still within the 60-day period. So that one copayment covers a 60-day period of care. Whether you come in and out of the hospital 2 or 3 times, it doesn't matter. One time, and that covers it. Now, if you stay in the hospital for 61 consecutive days, then on the 61st day, you will start paying a copayment, a daily copayment of $322 per day. And then if you go beyond 90 days, you go into what is referred to as the lifetime reserve days. You have 60 days that you can use, and that is if you go past 90 days, 90 consecutive days in a hospital. Now, that is very rare that would happen, but it does happen. And so you have up to 150 days. Day 91 through 150, you would pay $644 per day while using those lifetime reserve days. Now, this shows that additional 365 days that you have no pay. The Plan F and the Plan G do provide an additional 365 days of coverage, and I'll get into that more when we cover Plan F and Plan G in another video. But if you look down here under skilled nursing facility care, the first 20 days of skilled care, you do not pay anything. Medicare is going to pay 100% for those first 20 days. And you can see the requirements here. You have to have been in a hospital at least 3 days and entered a Medicare approved facility within 30 days after leaving the hospital. And it does have to be skilled care. For after day 20, for days 21 through 100, you have a copayment of $161 a day that you are responsible for. And then after day 100, Medicare is not going to pay any benefits. They're not going to approve any benefits beyond that. Also, you see there is some blood coverage and some hospice coverage here as well. So under Part B is going to be your outpatient services such as physician services, inpatient and outpatient medical and surgical services, whether in the hospital or out of the hospital. So this includes outpatient. This is going to include chemotherapy. If there's a cancer diagnosis and you were to need chemotherapy, that's generally going to be done on an outpatient basis. Some of that will be covered in the prescription drug plan. We'll get into a little bit more of that later. But generally, that's how it's going to work under Part B. And then you have a $166 deductible. That's your deductible for 2016. $166 that you will pay, or your plan will pay, depending on whether you go with an insurance plan or not. After that, you have an 80%, 20% split. Medicare is going to pay 80% of the charges, and then you're responsible for 20%. And that's basically how Part B works out. There's some other things such as excess charges. Excess charges means that if your doctor does not accept assignment, when Medicare has, when there's a procedure done and your doctor files with Medicare, Medicare will allow a certain amount of charge per procedure that is done. Everything that your doctor could possibly have a code for, Medicare has a set amount that they will pay for that. And if your doctor accepts assignment, then that means that he will accept that charge as payment in full. And the numbers are over 97% of all doctors accept Medicare assignment. We just had I put it in another video, we just had a Aetna put out where they had over 99, it was something like 99.62, I think was it, 99.62% of all the claims that they have come in do not have any excess charges attached to them, and the ones that do, the average is about $20. Because what happens is, if your doctor does not accept assignment, they can only charge you 15% more than what Medicare allows. So if you go to a doctor who does not accept assignment and the charge comes out to $100, the most he can do is charge you 15% above that, and that's what the excess charge is. So under Part B, the $166 deductible, that is a one-time per year deductible. Once you meet that in the year, you don't have to pay it again. And some plans will pay the deductible for you. Other plans you can pay out of pocket. Like I said, we'll get into a little bit more of that in one of the other videos. But it is a one-time annual deductible. That's it. Under Part A, we talked about the hospital deductible of $1,288. That is not a one-time. That covers 60 days of coverage. So if you go beyond that 60 days and have to go to the hospital again, you have to pay the $1,288 again if you don't have an insurance plan that takes care of that for you. In a perfect storm, you could pay that deductible 4 or 5 times a year. Never heard of anybody doing that, never heard of it happening, but mathematically, statistically, it could happen. Not trying to scare you. I don't want you to go into panic mode about any of this, because some of the other videos that we're going to do are going to address the options that you have, and that's what we're here for as an insurance agent. My job is to shop around, first of all, to make sure that you're educated. I want to have the heart of a teacher and make sure that you understand how the plans work, how the parts work that we've gone over. We'll get to the plans in another video. But I want to make sure that you understand how Medicare works so that you can make the best decision for your situation as to what plan would be the best for you to go with. And so we're going to get into a lot more of that. If you like what you've seen, or if you have any questions, give me a call. The phone number is 888-228-6119, and it's on your screen. Also, you can like us on Facebook. We're at Facebook/Integrity Senior Solutions. Facebook.com/Integrity Senior Solutions, and you can follow along. We update with some posts and articles and whatnot there, just information about Medicare, or go to our website, expertmedicare.com. You can also go down to the little YouTube button right there and click on it and see some of our other videos. Like this video if it was helpful to you. But if there's anything we can do to answer any questions, just give us a call. That's what we're here for. 888-228-6119. Like I said, my name is Keith Murray, and thanks so much for watching. Let us know how we can best serve you.